All right, so just an update as usual as to the recommendations of the COVID-19 task force, Crohn's and Colitis Canada's COVID-19 task force. We met on Tuesday night just to discuss whether any changes should be made to the guidance that we have for IBD patients in Canada. And this time, really, there were not that many changes. I think the major changes came in the last 2 weeks, but I'll review the change that we did make. So this diagram is exactly the same as it was last week. So if you want further details, do watch the webinar last week. It's archived on the Crohn's and Colitis Canada website or on the YouTube channel for Crohn's and Colitis Canada, but nothing really has changed there. So it is on the website at the present time. What we did change slightly was some recommendations regarding continuing use of IBD medications. This has not changed, and this is becoming increasingly clear that it is important that you not discontinue your IBD medications and that you reduce the risk of you flaring up, because it seems as though we're starting to get preliminary data that having severe active disease may put you at increased risk for bad outcomes if you get COVID. In addition to the fact that obviously the hospitals are quite overwhelmed, the clinics are mostly using virtual technology now, so it's harder to get access to proper care. Not impossible if you need it, but we want to reduce the risk, reduce the need for the healthcare system if possible. What we have changed slightly is that if you have symptoms of COVID-19, contact your doctor to discuss whether to stop or hold your medications. And we list specifically the symptoms, the common symptoms of COVID-19 being a dry, non-productive cough, shortness of breath, fever, diarrhea, and diarrhea and fever may be the only symptom in a small minority. So about 10 to 15% of people only have diarrhea and fever. They don't have the dry cough yet. And then the loss of ability to taste or smell, which people are describing as a symptom of COVID-19, although it's not 100% certain yet. So if you have any of those symptoms, please contact your physician to discuss whether or not to stop or hold your medications, particularly if you're on the immunosuppressive medications or the biologics. And then if your biologic infusions are delayed because you're isolated or because you have symptoms, contact your doctor to reschedule. And I think, gastroenterologists around the world are really evaluating when the drugs can be restarted. If you've confirmed positive for COVID-19 or if you have symptoms for COVID-19. But the bottom line is contact your physician if you've got symptoms. They'll help direct when and how to either hold your medications or restart your medications. And that's really all the changes for this week. Again, just a sort of caveat, what we know about COVID-19 is changing very, very quickly. And so these are just guidance documents. They're not formal guidelines for physicians or for patients. They should help you, but not replace the recommendations made by your physician or the local public health authority.